Just before that announcement, another call from those on the front lines to our state leaders, pleading for a drastic change of direction before hospitals have to execute those decisions. ABC 15's Cameron Polam talking to one of the doctors who will soon be helping staff Banner Hospital and why he believes a stay-at-home order may be our only hope of stopping the surge.
Another weekend in Arizona, once again filled with images like these. The Salt River packed with people, the same at a Scottsdale hotel pool.
I just think that that sort of behavior is irresponsible, inconsiderate, and not respectful.
Dr. Andrew Carroll is a board member for the American Academy of Family Physicians. In a matter of weeks, he'll be one of dozens of providers heading into local hospitals to assist with patient overload happening as we speak.
I think that we reopened much too quickly.
As hospitals expand capacity to keep up with coronavirus cases, they soon may turn to something called crisis care standards.
Crisis care standards are like battlefield medicine. If you're in the middle of a battle and people are hurt and just scattered in front of you, it's a way of deciding which ones you try and save and which ones you don't try and save, even though all of them are still alive.
Hard decisions as beds, staffing, and emergency medical equipment are pushed to the brink. In this case, it's left to math.
And part of that score is whether or not they believe that you would live life as long as a year afterwards and as long as 5 years afterwards. I'm going to compile that into a score and decide whether or not you'll be on a ventilator.
Those numbers are calculated outside the hospital systems to eliminate bias. There's now an effort underway to keep us from reaching that point, or if we do, reduce case loads and restore normal care standards as quickly as possible. That leads us to this petition delivered to the governor today and signed by more than 1,100 medical providers. It asks for 7 things. Reenact the shelter-in-place order and enforce it. Close bars and nightclubs. Limit restaurants to takeout only and require transparency regarding employees' testing. Mandate masks statewide and communicate concrete consequences for those refusing to wear masks in public. Increase testing capacity. Expand contact tracing. And enforce quarantine for those with suspected or confirmed COVID-19.
I talked to healthcare leaders from around the state.
How the governor pivots in this critical moment and how the community responds may write our final chapter.
Some people believe that if it doesn't touch them personally, that it really doesn't mean much. If we keep this up, it's going to touch each one of us personally.
I'm Cameron Polam, ABC 15, Arizona.